867-1965. That's 867-1965.
Ocala's information station, 1370 WOCA.
Ocala.
All right, 5 minutes after 11 o'clock, 81 degrees, and I think the rain is done. There was a 40% chance of rain. Maybe it's already out of its way. Usually it gets here in the afternoon. Right now we have Lauren Debick in the studio. Lauren is the manager of marketing communications for Ocala Health, and she always brings us some great guests. Today, her guests are Dr. John Cain and Brian Smith. Dr. Cain is a physician with Radiology Associates, and Brian Smith is the director of diagnostic imaging for Ocala Health. And Lauren, you always introduce us to new words. Today I have a new word I'm learning, tomography. I just learned this word, tomography. LDCD stands for low dose computed tomography. So this is our lesson for today. And I know it's got something to do with lung cancer. Am I right?
That's correct.
Okay. Well, how are you doing, Lauren?
I'm doing well. How are you?
Ladies first. Good. You look beautiful with your hair.
As do you.
No, I don't. Wow. She threw it right back at me.
I know.
All these
She's
weeks
good.
trying to make her uncomfortable.
Yeah.
Now I know what it feels like.
That's right.
But I know the truth. All right. Well, let's find out about this. Good morning to both Brian and Dr. Cain. Good morning to both of you.
Good morning. Good morning.
Do you both work in the same office?
Yes.
Similar?
Yes. Yeah, we both work at both Ocala Regional Medical Center and West Marion Community.
And are you exclusively working with lung cancer patients? Is that exclusive or?
No,
No?
In our radiology department and personally, we see all comers in the imaging field.
Okay.
But this is a new push we've been making.
Is there a way to define tomography? What does that mean?
Sure, I'll field that one.
I think I got the low dose. I got the computed. It's the word tomography I'm having a hard time with.
I think a simpler word would be slice. So everybody knows what a slice is.
A slice, yeah.
So if you take an apple and you slice it up into thin slices,
Okay.
You could say that's sort of what our CAT scan machines do with imaging the body. So
Okay.
they more or less slice up the body, and then we look at those slices. So the tomogram is a fancy word for slices.
Really? And can you tell, like, for example, if 3 of those slices have a black dot that shouldn't be there, that indicates something is not right to you or something like that? I'm trying to imagine.
That's correct.
Yeah?
So, yeah, if you can imagine, if you look at an apple on the outside, you just see a nice, pretty red apple. But then maybe there's a problem in it. Maybe there's a worm right there in the middle.
Oh, it's always a worm.
Something like that. But if you slice up the apple into 30 slices and then look at each slice, you can find out exactly where that worm or problem on the inside of the apple is. Now, we don't slice up people literally. We do it with imaging.
So knowing where it is doesn't tell you what it is. But does it help you diagnose what it is? In other words, you see,
Yes.
okay, there's something there.
That's right.
How do you figure out what it is?
Well, that's part of what we go to school and practice for decades for, is to look at the images, and by looking at different characteristics of something that you're questioning, determining whether it's something you don't have to worry about or something you do have to worry about.
So does the word biopsy play in this? Do you do biopsies of lung cancer tumors?
It does. That's another aspect of what I do and what we do in our department. If something that we do the imaging on, the diagnostic part, if it looks suspicious enough after a consultation with the patient's physician and that sort of thing, then we will actually use the same machine, CAT scanner, to guide our needle in from the outside of the skin. We can literally in real time follow the needle in to the area in question, the lesion or the mass, and guide our needle into that, and then fire the biopsy device and withdraw a teeny snippet of tissue that then goes off to the pathology department for one of the physicians there to look at with a microscope.
Wow.
And would this be done when a person comes in for a routine annual checkup, something like this?
Well, So sometimes somebody comes in for a routine checkup and gets maybe a chest X-ray. I'd say a common pathway for patients these days is they go to the emergency department for a complaint, chest pain, or maybe they start coughing and it hasn't gotten better, or maybe they started coughing up blood or something like that. One of those worrisome signs for lung cancer, and then their physician orders a CAT scan to be done to look more closely and to see if there is evidence of a CAT scanner. The problem with that is that if you wait until symptoms arise, that is, if you look at patients who only had their lung cancer found after symptoms arise, something like I mentioned, a persistent cough or coughing up blood, their 5-year survival rate's only on the order of 17 or 18%, which is not good.
Oh, really? Oh, that's scary. Okay.
So our whole hope in starting this program, and we're not just starting this here. This is something that started in the 90s with a long study, and this has been vetted by the government and various medical agencies to determine that this is a viable detection system. So we're just one of many programs in the country that are starting this, is to get the patient in before symptoms arise so that we can find that cancer in its early stages, and so that the medical oncologist and the surgeon can actually go for a cure in those patients.
Yeah, because my husband is now 6 years cancer-free. He had lung cancer. He had his left lung removed. He went in and he had a cold that wouldn't go away, and then they found that, and then they were able to help him. Around that same time, a friend of ours went in for a cold, and he was diagnosed with cancer, but it was in his lymph nodes, and he didn't live very long after that.
Yeah, so the whole goal, so your husband was one of the lucky ones, and our goal with this program is to make more lucky ones.
More lucky ones, yeah. And the earlier you go for diagnosis, the luckier you are.
That's right. The trick is you have to go before you become symptomatic.
So how do we know?
Well, so what?
I mean, should I go? I don't have any symptoms.
That's a perfect question.
I have crazy thoughts. Does that count?
You should go.
We have other tests for that. So part of the reason that it took from the 90s till now to start these programs is that the medical researchers wanted to define the people who needed to have this test done.
Okay.
Because to be an extreme example, a 15-year-old kid who doesn't smoke doesn't need this test. But after a bunch of study and a bunch of statistical analysis, they've validated that the group of patients who shows a very high likelihood of benefiting from this test are people who are age 55 to 77, or maybe 80, and patients who have a smoking history, and they've even defined the amount of smoking history. So it's something called, there's a measurement that doctors use to determine how much somebody smoked. It's called pack years. So one pack of smoking, smoking 1 pack a day for a year is a pack year. 2 packs a day for a year is 2. If you have 30 pack years.
Oh, really? Okay.
Wow.
30 pack years of history, and you're age 55 to 77, and if you're asymptomatic, then you would fall into our target group of patients to have this test done.
By the way, the phone lines are open, right, Laura? We're taking calls?
Absolutely.
And if you want to call, you are welcome to ask questions. The number is 622-9622. Brian, we haven't heard from you. Thank you for coming in as well. On the 11th, we were talking about the attacks of September 11th, and we were talking about the firefighters who didn't die that day, but were exposed to a lot of that stuff that they inhaled. And I think there was a bill passed by the president, as financial-wise, to help out people. Because of one of the firefighters who was named, actually, they found after he died in his autopsy things in his lungs that the normal person wouldn't have, just because of that. Does that show up in the imaging?
It can, depending on the disease or what exactly they're looking for. And Dr. Cain maybe could elaborate a little more, but it just kind of depends what's there.
So, for example, like we live in a relatively clean air city. If we lived in LA or New York, where the air is probably a lot dirtier, I'm guessing, would you see different results in the tests?
Sometimes pollution is bad enough to cause changes in the lungs, that's something that you occasionally will see changes on a CAT scan, which is more sensitive than a chest X-ray. You can see some interstitial lung disease and fibrosis.
We have a phone call, and if you'll put your headsets on, just be sure you can hear me, and if you can, then I'll say hi to you. No, that means hello. Can you hear me? Okay, good. That means your caller you'll be able to hear your caller. Good morning. Thank you for calling. You're on the air.
Yes, thank you. Your 1-pack and 2-pack theories are interesting. Now, how would that apply to, let's say, like a cigar or a pipe smoker who smokes a lot of pipe continuously?
That's a good question. So someone who smokes a cigar or a pipe, but not a cigarette smoker. I don't think it applies. I think cigarette smoking is what we're looking for in the target group. But that's a good question. I'll have to research that and find out the answer for sure. But I think we're talking about cigarette smoking when we talk about the number of pack years.
Because the difference is they don't inhale those two. Usually.
That is correct.
There was a story this way. I don't know if you saw this. This woman was at a counter. I don't know if she was at like a store in a mall here, and her purse exploded. She had one of those electronic cigarettes. What do you call them? With the lithium battery in it. You see these kids all the time with these things. They look like locomotives. Yeah. There's so much smoke coming out of them, right? Is that? I mean, it's maybe too early to tell if that's doing a lot of damage, but is it?
That's too early to tell.
Yeah.
We want to be careful in medicine and say what we know and stick to that.
Yeah.
If a person does have lung cancer and then, they have children and their children have children, is that hereditary?
Well, the vast majority of lung cancer is caused by cigarette smoking or is related to cigarette smoking, but not all lung cancer is related to cigarette smoking. To my knowledge, the number of patients who have some sort of hereditary cancer of the lung is very, very low. I can't think of any right now. That's not one of the cancers that is commonly known to be hereditary.
Mm-hmm. How does the screening take place? Do you lay down on a table? How do you do that? Is it one of those big tubes you go through, or?
It's more like a donut than a tube.
A donut?
Yeah. The shape of the machine.
I can handle that.
Yeah, well, I think what you're thinking about is an MRI, which is nowadays the newer ones are more donut shaped, but they used to be more tubular.
Okay.
This one's more of a donut, and you lie down on a table. It's very, very fast, 15 seconds.
Oh, really?
And there's no, for the screening test, there's no IV needed or anything. You just lie down on the table and
it's got to be scary, because oh gosh, sometimes we don't want to know. I guess you deal with this all the time. People who go through the test and God, I don't really want to know. But then when they come out and everything's clean, they say, "Well, thank God I know."
It's
true.
We're crazy people, aren't we?
How do you handle the emotional part of it, Brian, for when people come in?
Yeah, well, we have a really, really good staff, experienced, and they just have that personal touch. I think, a lot of them are in the medical field, if not all, for that reason, to help people. So they're there for the right reason and spend a lot of time, very hands-on, they're accommodating. We had one of our staff members actually scan a child's stuffed animal to put the child at ease and then show them the pictures. And that's the type of people that we have working with us to just, go above and beyond and treat it like it's your own family member.
What did you find inside the animal?
All right. Stuffed animal is going to make it.
All right, we'll take a little break and we will be right back. The phone lines are open if you want to call in, 622-9622. And Lauren, give us the number people would call to, maybe for the overall number for Ocala, the Ocala Health Hotline?
Absolutely. So any questions you have, just general health care, insurance, physician referrals, you can call us at 1-800-530-1188.
And we will be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident. Times of clouds and sun Thursday with a couple of thunderstorms around during the afternoon and evening hours, high 87 to 91. And partly cloudy later Thursday night, low 72 to 76. On Friday, intervals of clouds and sun with a shower and thunderstorm around during the afternoon and evening hours, high 88 to 92. For Saturday, partly sunny with a shower or thunderstorm, especially in the afternoon, high 87 to 91. From the Florida Weather Center, I'm meteorologist Joe Lundberg.
Hi, my name is Erica Olsteen. I'm a doctor of acupuncture and oriental medicine. So, you used to be wired, now you're just tired. You used to be thin, but now you're the heaviest you've ever been. You don't necessarily always have to take a med if your thyroid is playing dead. If you have a thyroid disorder, an acupuncture visit may be in order. Come visit me, your primary care physician, Erica Olsteen, at A Better You Healthcare. Call me at 352-615-5566.
Looking to put your money to work? Florida Credit Union has a CD special, 25 months for 1.41% APY with a $10,000 minimum. Federally insured by the NCUA, a government agency. These rates effective through September 15th, subject to change at any time. Visit one of Florida Credit Union's convenient locations today or their website, flcu.org, or call 352-237-8222. Don't miss this 25-month CD special. Again, the APY is 1.41%. Act now.
Don't get caught without your daily source of senior deals. Pick up your copy of the Senior Voice newspaper. It's your source for schedule and events tailored to seniors, with information you need, like a list of free events in the area. We even have Tom's Picks, a free referral for people who are looking for a company to do work for them. Tom's Picks will refer the company to you that fits your needs. And all we ask in return is that you tell them where you heard about them. For more information, call Tom's Picks, 352-804-1223. And pick up your copy of the Senior's Voice at most any business up and down the 200 corridor.
Now read Ocala Downtown newspaper online.
Hi, I'm Big Daddy Don Garlitz, asking you to support adoption by purchasing a Choose Life license plate from your county tag office. You know it costs a lot to give a child life. Many times a woman is forced to make a bad choice because of financial pressures. Help save the lives of the unborn children by aiding women whom choose life instead of abortion. Take a stand for life. Purchase your Choose Life license plate today. For more information, go to chooselife.org or call 352-624-2854.
Cookies, 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 cookies. We go cookie eating cookies.
When you want something special and fun for any occasion, get cookies. King Cookie in the Paddock Mall in Ocala will make a delicious, fun-filled delight just for you. So next time you're in the mall, stop by King Cookie or call 352-237-2557. KingCookieOcala.com. Customized cookies, cakes, and more. King Cookie.
Eating cookies. We're so happy eating cookies. Cookies!
Cookies. All right, 22 minutes after 11 o'clock. Thank you for tuning in this Thursday morning. Lauren Debick is here from Ocala Health, and she has invited two guests. Dr. John Cain is a physician with Radiology Associates, and Brian Smith is the Director of Diagnostic Imaging for Ocala Health. During the break, we were talking about the kind of, I guess, the protocol, how this all happens, and I wanted to ask you to repeat what you just said. So if I go to my doctor because I've got a condition, he sends me to you. I don't go directly to you.
Correct.
And so the question is, do I get any information from you? Do I get the results from my doctor? Do I have to go back to the doctor for whatever results you find?
So after we finish the exam and a report's generated, it goes back to the ordering physician, and the ordering physician would discuss the results with you.
Okay, so take us down that road. Let's go for the worst possible scenario.
Just so a patient would come in either for their annual appointment with their physician.
Right.
And then go through certain criteria, though the primary care physician then would make sure you meet the criteria. They have what they call a shared decision session where they talk about the risks, the benefits of the exam, the importance of smoking cessation or quitting smoking, and the importance of following up annually with these exams. And if you've met the criteria, your physician would then write an order and send it over to us. We would do our back-end paperwork and then contact the patient and schedule it with us.
So if there was nothing at all, the patient goes back to the doctor and he says, well, you're clear, that would be the results were negative, right? The word negative is good news.
That's
right.
correct.
Positive is bad news in this world, in your world, right? Okay, so
Can be, yeah.
So talk about the guy who's positive. He goes back to his doctor. What happens from that point on? You're out of the game by that point? He does, or do we go back to you after treatment, or how does that work?
So it's relatively common to have some findings, or in other words, a positive result from this, but not all positive results are necessarily bad.
Really?
Yeah, so a lot of people have, just like people's skin has moles on it and things like that that aren't necessarily cancerous. The same thing with the lungs. Lots of times there are little nodules in the lungs that are benign, and they've been there for a while. So some patients, the majority of patients that go through the screening will end up with a negative result, and they just need to come back the next year. And it's important, we sort of touched on this, but this is not a one-time test. It's like getting a mammogram. You get a yearly You get a yearly exam until you're into your 77 or 80s, in which case we tell you you don't need to do it anymore.
Why is that? Why don't you do it anymore?
Well, that's a little.
You could die anyway.
That's a little controversial.
You're gonna die anyway. What difference does it make? How old are you?
We could talk about that a little longer, but
forget it. Who cares? You got cancer. Just live with it.
Well, that gets a little complicated, but it has to do with the risks, the benefits of the test, and how old you are, and life expectancy, and that gets a little more into the government committee sort of deciding where to spend money and that sort of thing.
The government committee, okay.
But if you do have symptoms, then it's a whole new ballgame. Then your physician, then we're not talking lung screening. You're coming in.
I see. Okay.
So it's not like you're left out.
And the biopsy, do you do that?
Yes.
Oh, you do?
Generally. It gets a little complicated. A lot of the biopsies we do in the radiology department using the CAT scanner, sometimes the biopsy would be done by a pulmonologist through a scope that he inserts down your windpipe, and then sometimes a surgeon does the biopsies. So it sort of depends, and it's probably more than half we would do. But getting back to your question on what happens if you have a positive result, most of the positive results are just going to be something that we follow, that we do a little more short-term follow-up on. We might wait 3 or 6 months and do another CAT scan, and then we might just keep following it a little more regularly than once a year, a little more rapidly than once a year, and then we'll just follow that finding and make sure that it's stable and hasn't changed in size, and after a while we'll say, it's been stable for 2 years, that's benign, we can just go back to the 1-year follow-up for you.
And will insurance cover this?
Yes, if you meet the criteria that we mentioned before, for insurance, and it's 55 to 80. For Medicare, it's 55 to age 77. 30-pack year history of smoking and asymptomatic, and you've gone to your doctor and had this discussion with them, then insurance and Medicare will cover this.
Seems like, Robin, when Ronnie was diagnosed, it seemed like it was like no time at all before he was in the hospital getting his lung removed. It was very quick.
Real quick.
It was just like, okay, you're in, you're out, we're going to get it out of you. It's amazing how healthy he is now without a lung.
We want more stories like that.
There are?
No, we want more stories.
You want more stories, yeah.
We want more happy stories like that.
Do you have a place online for your practice where people can submit their happy stories?
Absolutely. They can reach out again to that health hotline number at 1-800-530-1188 and talk to the folks there, and then they can relay that information to us, and we'd be happy to share that.
Oh, that'd be wonderful. I love the one about the child with the little bear.
Yeah.
That is.
I hope this isn't an off-the-wall question. Earlier this morning, we had a discussion about stem cells instead of knee replacement. Is there any hope that stem cells will one day fix cancer in the lungs or anything like that?
Well, I don't know about lung cancer in particular. I mean, I know that it's a really interesting field of research, stem cells. I don't know of any treatment for lung cancer in particular that stem cells are being tried on.
You never know what the future holds, right? The future's, it's unbelievable how many things have changed. Just the fact that you can do something like this tomography thing.
Yes.
Was that?
Sure.
Wow.
I like that name.
Lauren, do you want to leave with any numbers again? I know you've already given us the number, but...
Yeah, just one more time. It's 1-800-530-1188.
Lauren, you bring us some really great guests.
Thank you for having us.
Thank you for doing that. And anybody who didn't get the number, call us. We'll be glad to repeat it. Please share the video. Somebody's life could be saved simply by sharing this information. Lauren Debick, thank you.
Thank you.
Dr. John Cain, thank you. And Brian Smith, thank you. Thank you all for coming in today. We'll be right back. Fun with Joe is up next.
Fox News Radio.